Stomach ulcer, also known as gastric ulcer, develops as the stomach's outer mucosal membrane erodes, allowing gastric acids and digestive enzymes to eat away the stomach cells. That eventually leads to open lesions that are inflamed by the stomach acid. As time passes, they may develop a hole all the way through. It's a relatively rare but serious condition that can be life-threatening. If a stomach ulcer is not treated properly, it can cause excessive bleeding, resulting in anemia or low blood cell count. It can also constrict the channel leading from the stomach into the duodenum and block the movement of food into the small intestine. Some stomach ulcers can progress to cancer. Patients with stomach ulcer experience some symptoms such as abdominal pain, indigestion, nausea, loss of appetite, vomiting, weight loss or weight gain, bright or altered blood present in vomit or bowel motions, symptoms of anemia such as lightheadedness and shock due to blood loss. Are you curious to know about the causes of stomach ulcer? The two most common causes of stomach ulcers are: Number 1. H. pylori infection. H. pylori is a chronic bacterial illness that affects as much as 50% of the world's population. It typically inhabits the gut. The bacteria continue to grow, producing persistent inflammation and gastric ulcer disease by eating into the stomach wall. H. pylori infection is linked to around 60% of duodenal ulcers and 40% of stomach ulcers. Number 2. Excessive usage of NSAIDs. NSAID is an abbreviation for non-steroidal anti-inflammatory drug. This includes over-the-counter pain relievers, including ibuprofen, naproxen, and aspirin. On contact, they irritate the stomach lining and suppress some of the substances that protect and heal the mucosal membrane. Overuse of NSAIDs is responsible for up to 50% of all peptic ulcers. Other less common causes of stomach ulcers include Zollinger-Ellison syndrome or long-term emotional stress. To prevent such circumstances, let's talk about what foods to avoid and what to consume to treat stomach ulcers. Foods that trigger ulcer. The diet that you consume can affect how you experience when you have an ulcer, and consuming the appropriate foods might help you reduce symptoms and potentially even aid recovery. However, some foods might cause ulcers and aggravate the condition. Some foods that should be avoided if you have a stomach ulcer are: Number 1. Alcoholic beverages. Excessive alcohol use is indeed a major cause of stomach ulcers. It's also a risky drink for people who are already suffering from ulcers. It raises the acidic level in the stomach, aggravating the symptoms of pre-existing ulcers. Number 2. Milk and dairy products. Some people may feel that a cold cup of milk provides temporary relief, but it actually worsens the symptoms of a stomach ulcer. Whole products, including many dairy products, are heavy in fat, which might worsen the existing symptoms. It also stimulates the formation of extra stomach acid, which can worsen stomach ulcers into stomach cancer. Number 3. Carbonated drinks. As an additive, carbonated beverages include citric acid and other acidic compounds. These compounds disrupt the stomach lining, which causes stomach ulcers. Having carbonated drinks causes a rise in stomach acidity, worsening the issue. Number 4. Caffeine. Caffeine, along with other components in coffee, stimulates the formation of stomach acid. Catechol and N-alkanoli-5-hydroxytryptamine are two chemicals that induce the formation of stomach acids, which aggravate the ulcer disease. Number 5. Salt. High salt consumption has been related to an increased evidence of stomach ulcers. If you currently have a stomach ulcer, you could cease putting salt in your meals. According to research, a highly salted diet may stimulate gene expression in H. pylori, making it more active. Avoid foods that are heavy in salt, such as cornflakes, salted meat, bacon, etc. Number 6. Spicy foods. The American College of Gastroenterology, or ACG, stresses that spicy foods do not cause peptic ulcers. However, it states that spicy foods irritate an already existing ulcer. If you already suffer from an ulcer, spicy foods might aggravate your symptoms. Therefore, you should avoid these at all costs. If you're not suffering from an ulcer or experience an issue with spicy meals, feel free to continue consuming spicy meals. After discussing the food to avoid stomach ulcers, the main question comes to mind: which foods should be eaten to cure stomach ulcers? Let's discuss the amazing foods that can fix your stomach ulcer naturally. Foods to eat. Number 1. Aloe Vera Gel. Aloe Vera Gel is a natural antibiotic which is one of the ancient medicines. It eliminates some of the fundamental causes such as H. pylori, while also healing wounds and rebuilding cells. Aloe vera not only cures ulcers but also improves skin texture and prevents wrinkles. If you're suffering from a stomach ulcer, You have multiple sores on your stomach wall that can be healed by using 2 tablespoons of inner gel from an aloe vera twice daily. For a more effective result, mix it with a small amount of water and drink it on an empty stomach before going to bed. Number 2. Cranberries. Cranberries are the most common food when we talk about healing stomach ulcers. Tannic acid is an antioxidant found in cranberries. Tannic acid binds with H. pylori bacteria in our stomach, making them sticky slime, so they're unable to be moved and cause ulcers by drilling holes into the walls of the stomach. Cranberries are fantastic for removing the root cause of stomach ulcers. You may eat 1 serving of fresh or frozen cranberries per day. Number 3. Cabbage Family. The most successful method to treat a stomach ulcer is to use an ingredient known as vitamin U, which Dr. Garnet Cheney discovered at Stanford University of Medicine in the 1950s. Vitamin U, a form of the amino acid methionine, is an element found in high concentrations in all types of cabbage. According to research, vitamin U from cabbage repairs the layer of mucus in the stomach, covering ulcers, and allows them to recover spontaneously. Start by consuming freshly produced raw cabbage juice. Number 4. Probiotics. H. pylori infection can disrupt the equilibrium of microbes in the stomach. Taking probiotics like lactobacillus, which is naturally found in the stomach, may help to restore the normal equilibrium of microbes. A review published in 2014 of clinical trials concluded that consuming probiotics with prescription drugs can improve the efficacy of treatment. Some studies also show that consuming particular types of probiotics may help to minimize antibiotic-related adverse effects, enhance the harmony of gut flora, and make therapy more efficient. Number 5. Olive oil. In clinical trials, olive oil suppressed H. pylori development, but it additionally decreases cholesterol levels and contains anti-inflammatory properties as well. In one 2012 trial, patients with H. pylori infection were given different amounts of olive oil every day for 14 days. Scientists concluded that olive oil may be somewhat useful in treating H. pylori infection. People with stomach ulcers can benefit from consuming extra virgin olive oil for baking and cooking with, as well as in salad dressings and sauces. Number 6. Raw honey. It's a nourishment that can cure an upset stomach quicker than anything else. It's not intended to repair stomach ulcers. Honey is also abundant in minerals and phytochemicals, which aid in strengthening your immunity. It also helps with sleep issues. Raw honey has strong antibacterial qualities that kill H. pylori, the bacterium that causes stomach ulcers. It has a relaxing impact on the digestive tract, reducing discomfort and soreness. Honey also contains fructooligosaccharides, which aid in the healing of stomach cell lining and the prevention of ulcers in the future. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell icon to view more upcoming Create Cure content like this.